You've all heard me tell the people with whom I intervene for drug and alcohol abuse, any kind of addiction, that I will haunt them to the ends of the earth once I get involved, and I mean it. You've also heard me say that you must never, ever surrender to the disease. And what I mean by that is you just don't ever drop your end of the rope. I mean, it is a tug of war. And we think outside the box in designing what addicts need. And we know that the most dangerous phase of treatment is clearly the transition from the structured environment of the rehabilitation center to the unsupervised world they face on discharge. Now, to bridge that gap, I've actually created a virtual reality tool to help that transition go smoothly. When people get out of rehab, what happens? They face triggers for relapse: old friends, old hangouts, old habits, access to their substance of choice. So we've created our own triggers for coping in the form of a never-before distinctive VR experience, virtual reality experience. What you want is something that stands out. Look, most of our life is wallpaper, right? And things don't pop out. What you need is something that pops out of the noise, something that rises above the noise, like a distinctive voice. And that voice, in this case, is me. Because I want to be there, I want to be in their head, and it's me training these folks on how to handle these high-risk situations on discharge. And so the most elite programs in the country now have this tool as part of their protocol. It's called Dr. Phil's Path to Recovery, and it's intended to offer a unique experience where patients can sit down in a face-to-face setting with me without ever leaving the safety of the facility. And I'm going to show you what I'm talking about. Eric, come on out. Here's my techie, Eric. All right, we go put this on, and we've got this wired to the screens. You're going to see on the screens what Eric is seeing in the goggles. Now, this is pre-recorded. Okay, Eric, look up. Now look to your left. This is what he's seeing. Now, what I've done here is I've put them in a bar situation. So while they're in rehab, they're sitting talking to me in a bar. Now they're sitting, and this is actually in my backyard. So I can talk to them in a relaxed setting where they can hear and remember some coping strategies in a 3D virtual reality situation. Expect my dog to come walking through any minute here. But look up at the sky. See, this is actually the virtual reality world. You have to go to a function with people, you see the triggers of the alcohol bottle sitting there, you see people around, you've got peer pressure. So I can talk to them in this situation while they're still in rehab without them actually having to go to a bar and see the triggers. So you've got a distinctive voice that complements the existing program. And this is such a powerful tool. Okay, take it off so you don't. So what's your experience when you look in there?
That's crazy. It's like you're actually there.
It's very realistic, right?
Very realistic. It's like you're there in all these environments. Like, it's an amazing way for a teaching tool.
Yeah, it's scary, actually. It's so real once you put it on. So, and for more information about facilities that actually use this technology, you can go to drphil.com and see what's there.